Let's talk about vaccine a little more. We have been talking about AstraZeneca, we have been talking about Sinovac, and sometime we talking about Pfizer. And I think a couple of days ago, we were talking about Johnson & Johnson, the single
the
shot.
single shot one.
The single shot COVID-19 vaccine. Today, I want to talk about the vaccine developed by Russia. It's called Sputnik V. Sputnik V actually was the first one that was a headline news everywhere in the world, that it was certified and was talked about by the Russian government. And it came out fairly quickly compared to other vaccines last year. Though it was the first, the public had doubts about its efficiency. However, the latest publication on the medical journal, The Lancet, might help answer some of the questions. The article stated that from 20,000 participants in phase 3 trials, 2-dose Sputnik V vaccination offered 91.6 efficacy against symptomatic COVID-19. And let me remind you that Coronavac by Sinovac of China have only 50% efficacy, and AstraZeneca has about a little over 70% efficacy. So an independent Lancet commentary, Ian Jones of the University of Reading and Poleroy of London School of Hygiene and Tropical Medicine, said that the development of the Sputnik V vaccine has been criticized for unseemly haste, corner cutting, and an absence of transparency. But the outcome reported is clear, and the scientific principle of vaccination is demonstrated, which means another vaccine can now join the fight to reduce the incidence of COVID-19. The study did a randomized, double-blind, placebo-controlled phase 3 trial at 25 hospitals and polyclinics in Moscow, Russia. They included participants aged at least 18 years, no infectious diseases in the 14 days before enrollment, and no other vaccinations in the 30 days before enrollment. So now we have a Sputnik V vaccine that will be another player. I'm not sure if the word player is the right word to use here, but I would say it will be another player in the vaccine arena right now. So we have like 4 or 5 months already.
And with the Sputnik V, when it was first introduced to the world, many people were so excited because it was the first registered vaccine.
Yes, it was the first registered vaccine, but then it's not like China when they launched their Sinovac. A lot of countries tried to get a grab on it, including Thailand. But somehow Sputnik V never really get the same kind of welcome, the same kind of response from the rest of the world. But I think this the article on The Lancet might change a lot of people's mind.
Right, and it is true that people are highly focused on the Pfizer vaccine, Moderna, AstraZeneca, and Sinovac. But Sputnik V, although it has been a big hype at the very beginning of its introduction, it's sort of sloped down with the interest and all these things. But maybe because of this recent research here, people might start to look at it a lot more, whether it's actually efficient compared to other vaccines that we've been talking about so far.